a plethora of other things. Don't know why I said plethora. Hello everybody, it's Charlie and welcome back to my channel, or welcome to my channel if you're new. Today I'm going to be doing a video about the things I really don't like about dentistry. Just to start off saying, I absolutely love my team. I love the practice that I work at. We've got a brilliant team there. Great managers, great boss, great girls, love them all, no problems there. So I don't want people commenting on this video saying, well, if you don't like it, then go and get a new job. That's not the point of this video. I'm just picking out the things that I don't like about the job. As in every single job that anybody will have, there's going to be things that you don't like about it. Now, I've said this in videos before, but I'll reiterate it. It's not the best job in the world, for me personally anyway. I, like I've just said, love my practice, love my team. The job side, I don't really like it that much, but it's not enough for me not to do it anymore. I'm going to get back on track now, and if you would like to see me talk about the things I don't really like about dentistry, then just keep watching. So, most of these are patient related. I actually did start like a series on this channel of, can't remember exactly what it was called, but it was like patients that we don't like or something like that, and it was just about the types of patients. Video idea, types of patients. It was just basically about the different types of patients that we get in and what they specifically say. So this video is kind of like that, kind of a bit different. Anyway, I'll just start. So the first thing I don't like about dentistry is late patients. Obviously, there are, of course, circumstances which make you late and they're out of your control and you can't help it. That is absolutely fine. The protocol for that would be, if you know you're going to be late for some reason, either there's a lot of traffic, somebody's blocking your driveway, I don't know, if there's a circumstance which is going to make you late, protocol would be to ring and let them know that you're going to be late. Again, certain circumstances mean that you can't ring, in which case when you get to the desk, you would just say, I'm so sorry, I know I'm late, this is what happened, is it still possible to see me? I know that a lot of people don't want to rebook, but people also have to understand from our point of view as well. Like I said, ring if you can. If you can't, explain it when you get to the desk. I think the polite thing is to always offer to rebook, and the chances are they're gonna see you anyway. Come on in! Unless you're like an hour late or something. You understand you're late, you know that it's gonna put the dentist out, so you've offered to do something. Chances are the dentist is gonna say, no, I'll see you, that's fine. Not just late patients, but the ones that don't apologise or acknowledge that they're late in any way. I mean, we've had people come to the desk and they've just said, Mr. Smith, I've got an appointment at 10 to 12 and it's 5 to 12. So they've just told you their appointment is 10 to 12, knowing full well it's 5 to 12, so they've missed 5 minutes of their appointment, and they just don't acknowledge that they're late at all. And if you say, oh, I'm going to have to check for you are a bit late, they go,
well, I'm only 5 minutes late.
But it makes so much difference. That 5-minute appointment makes so much difference to us, especially emergency patients who are late. Just do not ever do it. I know there are circumstances, and if you phone or if you explain, fine. It's the ones that don't apologise and just don't acknowledge that they're late and, you know, complain basically. Anyway, I feel like I've talked for a good long time about late patients. Let's move on to number 2. So the second thing, when patients phone for an emergency and they demand certain times. Now again, this is something that I've talked about in videos before. Of course, I understand completely that you have a schedule to work around as well. But what a lot of people don't get or don't care about is the fact that we also have a schedule to work around, and we cannot possibly get every single emergency patient in when they want to be in. You just couldn't do that. Your day would be all over the place if that was the case. So when patients ring up for an emergency, the protocol is to, you know, say, I've got a really bad toothache, can I please see a dentist for an emergency appointment today? And they're going to say, yep, no problem, and then give you the time of the emergency space we have. Now, generally, most people are going to say yes. You know, if they've got a real bad toothache or they've got a problem that they need sorting and they want sorting today, they're going to say, yes, I will take that emergency space. The way that I feel about it is that if I had something that I needed sorting on the day, I would move everything else to fit in with that thing that I needed to do. And again, I completely understand, you know, if you're a teacher or you're a doctor, or whatever it is, and you have to work certain times, I do understand, and we always try our best to accommodate for that, but it's not always possible to do. You know, we might have a 40-minute treatment at the end of the day, therefore we're not going to be able to get you in late in the afternoon because we've got somebody in the chair for that entire time. There's so many different circumstances to it. I do understand people have schedules to work around, but we have it as well. As much as possible, we really need patients to just accept the emergency times that we have. We also have patients come in for an emergency and complain that we're running late, and you just think, but we've squeezed you in today. Chances are, if you come in for an on-the-day appointment, you're not actually going to be seen at that time because you're not the only person that needs to be seen as an emergency that day. Patients have to work around our working schedule just as much as we try and work around their schedule as well. Moving on to point number 3, when a patient comes in for a checkup but tells you that they need work doing and they want it done there and then. So what I mean by this is a patient will come in for a checkup and they've broken a tooth, and they'll say to the dentist, oh, I've also broken a tooth. This is annoying in itself because the best thing to do if you break a tooth or you've got any problems is always ring. Don't just think, oh, it's fine, I'll tell them at my next checkup. A lot of the time for broken teeth, patients will do this, and it is okay, but we would prefer to know about it before you come in. So even if you've got an appointment tomorrow and you break your tooth today, just phone up and say, I've got a checkup appointment tomorrow, but I've just broken my tooth. And what will happen, what I would do anyway, and what everybody else would do in my practice, is just pop a little note to the dentist that a patient's broken the tooth, but they're coming in for a checkup. So that dentist knows going into the checkup already, he's gonna have to assess this broken tooth. So that's the best thing to do, is just ring up whenever you have a problem. Don't just assume that you should come in and tell them while you're there. Like I said, this is okay, it's just preferable that you ring. What's not really okay is coming in for a checkup with a problem and wanting that problem sorted in your checkup appointment. We've got 10 minutes for a checkup appointment. We cannot do a checkup and this at the same time. You know, if say you've got a broken tooth and you phone up and you say, I'm not really bothered about the checkup appointment, can we swap it to a broken tooth appointment? That then gives the dentist 10 minutes to likely just do a temporary, because again, fillings in 10 minutes, a bit hard to do. But if we can at least get a temporary in there, it's better than nothing. Kind of same with emergencies really. If you've got an emergency appointment, don't expect that you're going to get a filling or a root canal or a crown prep in an emergency appointment. A dentist does not know what he needs to do until he see, or she, until they see that tooth and the problem that it's causing. So don't assume that you're going to have treatment in an emergency appointment, but specifically more in checkup appointments if you've got a problem. Okay, let's move on to number 4 now. So the fourth thing I don't I kind of went a bit high there. The fourth thing I don't really like about dentistry is root canals. I hate root canals. They are very tedious and boring for the nurse. We can't really do anything. All we do in a root canal is suction while the dentist drills, which is maybe 5 or 10 minutes, and then it's all up to the dentist to file out the crap in there. We just kind of have to sit and watch. There are times, obviously, when you're going to have to, well, the dentist will irrigate and then you suction, only a couple of times in like the space of however long. Root canals are sometimes like an hour appointment anyway. It's quite a long time to just be sat there watching the same thing. And I will admit, probably shouldn't admit this, but I know I'm not the only person that does it. I daydream when we're doing a root canal treatment, and your mind does go off somewhere. Not the best thing to do, not very professional. Hold my hands up to it. I know I shouldn't be doing that, but it's very hard not to drift off into a daydream when you're just sat watching something like that. If you're still training, do not go off into a daydream. You want to be watching what the dentist is doing to learn about it. Yeah, that's another thing I don't like about dentistry is root canals. Mainly because they're just so boring for the nurse. Anyway, let's move on to the 5th and final reason of why I don't like dental nursing. Now again, this is kind of patient related. It's being had a go at for things that are completely out of my control. This luckily doesn't happen very often, and because I'm quite used to dealing with rude patients, you get used to how to handle it over the phone and things like that, or even face to face, because I actually have had some very rude patients to my face, and it does stun you a little bit because you're sort of sat there like, I just don't know what to say. I'm a bit speechless, especially when it's something you have absolutely no control over. And I'm going to give an example of this. What happened was that a patient wanted to book a hygienist appointment. Now, the way that we work our hygienist appointments is that we always recommend, if a patient needs 3 monthly hygienist appointments, we always recommend booking 2 up at times. They've got a 3-month one and a 6-month one, and what that will do is allow them to always have a pre-booked hygienist appointment, because ours book up ridiculously quickly. Anyway, what happened is that a patient had come up and she wanted to book in a 3-month hygienist appointment. She hadn't pre-booked it before, which is fine. Patients don't always have to do this. We just recommend it because it is really difficult to get in with a hygienist in the next 3 months. Anyway, she'd come to the desk, she'd come out of the hygienist surgery, and the hygienist will say to the patient, I want to see you in 3 months' time. But there was nothing in 3 months, so I offered her 4 months. She got quite angry and was just sort of saying, no, 3 months, the hygienist has just told me I need to book a 3-month appointment. So what I did was I offered her to have a 4-month appointment, but to go in our cancellation book. Now, we go through the cancellation book very regularly. We go through the cancellation book often. And what we would do is, if a hygienist has a cancellation, which would be very obvious if they do, because it'd be a great big white space in their book, we go through our cancellation book and we see the people that needed a cancellation. If they're specific, like I need an appointment on a Monday, and if this cancellation is on a Monday, we would phone that person and we would just go through the list until somebody says yes. So that's what I offered. I offered to put her in the cancellation book because the chances are, if you go in that book, you're going to get an appointment in the next 3 months, because people always cancel. But also to have a 4-month appointment booked in, so that if there wasn't a cancellation, she at least had one in the book. She was not happy with this either, and she just stood there and stared at me, and she went, right, so what you're basically telling me is you're not going to do anything for me. I've just given you 2 different options. I was a bit stunned. I was like, I don't know what to say, and I think I just said something like, I have given you a couple of options because I don't really know what else to suggest, because the hygienist hasn't got an appointment in 3 months. She was just staring at me, almost in basically complete silence, and wanted me to do something. I even offered to put her in with a different hygienist, which I could get in 3 months' time. So we have 2 different hygienists working for us. This particular patient was with hygienist A. Hygienist B had an appointment in 3 months, so I offered her to have a different hygienist as well, so that was another option. She did not want this. She wanted hygienist A, she wanted it in 3 months. And to add to this as well, she could only do Mondays or Thursdays, and hygienist A doesn't work on a Monday, so that was out. So that was the only option I could have, was that it had to be a Thursday, and it had to be with hygienist A, and it had to be in 3 months. It was really, really hard to work around. I feel like sometimes patients expect us to take somebody else's appointment, delete them, and then just stick them in there. I gave her 3 different options, and she wasn't happy with any of them. There wasn't a lot more I could do except the cancellation book. In the end, she just walked out. She was like, I'm not dealing with this anymore, and just went. So I put her in the cancellation book because I thought, well, at least she'll be in there that way, and if we get an appointment in 3 months, great. It's never ever pleasant when somebody is speaking to you like that. There was also a patient behind her, and he was sort of looking at her like, mate, what are you on? At least there was a couple of witnesses for that, and I also made sure to write this down because I thought I don't want her complaining about me and getting into a massive hoo-ha. So I did write a huge note about what had just happened. I know that was a bit of a story time. How long have I been filming? I've been filming for a very long time. This video is going to take a while to edit. There are definitely more, so if you would like another video like this, I'm more than happy to do it. I would love to do one. So just let me know and I'll make sure to do that for you. If you've experienced any of these things, let me know in the comment box below. Anyway, that is it for my video today. I really hope you guys enjoyed it. If you did, then please give it a big thumbs up, click that subscribe button down below, and then click the little bell next to it, and that will notify you when I next upload. And I will see you guys in my next video. Bye!